and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. For this second episode of the month, I will discuss another article from the recent issue of JAT titled Neuroplasticity in Corticolimbic Brain Regions in Patients After Anterior Cruciate Ligament Reconstruction by Dr. Shelby Baez and colleagues from Michigan State University and the University of Kentucky. As a reminder, the article discussed today can be found on the JAT website, natajournals.org, and please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. First step, surveying the scene. Within the United States, approximately 200,000 ACL injuries occur, where the majority of the patients with this injury will undergo surgery to have their ligament reconstructed. Most patients select a surgical procedure in order to allow them to resume their previous level of physical activity. Despite the surgical intervention, nearly a third of patients will not return to their previous activity level, with injury-related fear commonly being cited as the primary reason. Patients who do return to sport with increased injury-related fear are 13 times more likely to sustain a second ACL injury within 24 months of clearance. In addition to increased injury-related fear, patients following ACL reconstruction may also experience synaptic connections in functional networks, a process known as neuroplasticity. In select sensory motor brain regions, previous work suggests that brain activation profile of patients who underwent ACL reconstruction may indicate a visual motor strategy preference over a sensory motor strategy to engage in knee movement, as evident by increased activation in the contralateral motor cortex, lingual gyrus, and ipsilateral second somatosensory area, as well as diminished activation in the ipsilateral motor cortex and cerebellum when compared to healthy match controls during a knee flexion extension task. Interestingly, the authors noted that the second somatosensory area is a region of the brain that is activated in response to a painful stimulus. However, during this specific motor task in which brain activation was being recorded, the participants reported no pain, suggestive of psychological factors coinciding with the peripheral neural adaptation. Therefore, injury-driven neuroplastic events in the corticolimbic system areas, an area that processes emotions, may have occurred and may explain heightened injury-related fear associated with patients after ACL reconstruction. Having a better understanding of the mechanisms that contribute to injury-related fear may lead to interventions and return to sport criteria that better targets this sensory perceptual impairment. Therefore, the purpose of the study was to identify brain activation patterns underlying the neural substrate of injury-related fear during a visually based picture imagination task in individuals with ACL reconstruction and healthy controls. As a secondary analysis, the investigators aimed to determine whether the type of imagery, sport-specific, or activities of daily living influence brain activity. Brain activity was assessed using a functional MRI that measured the blood oxygen level dependent known as BOLD percentage signal changes in the corticolimbic brain regions. 12 female participants who underwent ACL reconstruction that were cleared for full activity and 12 healthy match controls participated in this study. Participants underwent a functional MRI scan. During the scan, participants first asked to focus on a visual fixation cross to allow for the participants' hemodynamic response to stabilize to a baseline level. Participants were then presented with 40 pictures that depicted sporting tasks such as jumping, running, hopping, as well as 20 pictures of activities of daily living, tasks such as sitting, reading, and grocery shopping. When the picture was shown, participants were instructed to imagine themselves completing the task in the picture. The order of the pictures were randomized and shown one time for 3 seconds. After each picture, the participant was presented with the visual fixation cross to reallow the participant's hemodynamic response to return to baseline. Following the imaging protocol, all participants completed the Fear Avoidance Belief Questionnaire, which measures fear avoidance beliefs, and the Tampa Scale of Kinesiophobia 11, which measures fear of movement. Here are the results. First, let's look at the differences in scores on the self-reported questionnaires. Similar to previous studies, the ACL reconstruction group reported higher levels of injury-related fear than the healthy control group. For brain activity, irrespective of the picture category, the ACL reconstruction group showed increased activation in the corticolimbic brain regions, which included the medial-dorsal thalamus, inferior parietal lobule, and cerebral lobule 9, when compared to the control group. Also, the ACLR group displayed an inability to suppress the default mode network. The default mode network is an area of the brain that typically shows greater activity during periods of rest while actively performing a goal-specific task such as the picture imagination task. When comparing activity between specific images and activities of daily living within the ACL reconstructed group, differences were observed in the inferior occipital region and cerebellum 9 region. Each of these regions had increased activation when participants visualized sport-specific images compared to activities of daily living images. As the authors hypothesized, the results of the study indicate that injury-related fear after ACL reconstruction does not merely subjectively occur as a response to injury, but may also induce objective and measurable neuroplastic adaptations in the corticolimbic brain regions. Also, this study shows that both sport-specific and activities of daily living may induce a fear response in individuals after ACL reconstruction. Finally, in addition to corticolimbic regions, the ACL reconstruction group was unable to suppress the default mode network. The inability to suppress the default mode network has also been reported among patients with psychopathological conditions such as depression, anxiety, and chronic pain. The findings of this study further identify the importance of integrating psychologically informed clinical practice techniques while treating patients after ACL reconstruction. An example being including patient-reported outcomes that measure injury-related fear as part of the rehabilitation process. As reported in this study and across other studies, patients after ACL reconstruction often have increased injury-related fear that commonly remains elevated after return to sport. Outcome surveys such as the Fear Avoidance Belief Questionnaire and the Tampa Scale of Kinesiophobia 11 may allow rehabilitation specialists to quantify the magnitude of injury-related fear and identify specific tasks that contribute to the fear. Psychologically informed clinical practice also emphasizes the integration of cognitive behavioral therapies and psychoeducational techniques in conjunction with traditional musculoskeletal rehabilitation. Rather than solely using pain or soreness as a guide for progression, clinicians can use fear as another progression criteria across different levels of exercises and tasks. In this instance, the goal would be to decrease the fear as the patient progresses through a given exercise or task, which in return may not only decrease injury-related fear but also induce neuroplasticity in the corticolimbic regions, so the activation patterns within this region more closely resemble that of individuals with no injury history. Well, that's it for today's JATCast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on Twitter, Facebook, and Instagram at JAT_NATA. Thank you for listening and keep a lookout for next month's JATcast.